Welcome to Public Health on Call, a podcast from the Johns Hopkins Bloomberg School of Public Health, where we bring evidence, experience, and perspective to make sense of today's leading health challenges. If you have questions or ideas for us, please send an email to publichealthquestion@jhu.edu. That's publichealthquestion@jhu.edu for future podcast episodes. This is Josh Sharfstein. Today, some food for thought. Can we take a public health perspective on food assistance in the United States? I speak with Jerry Mand, CEO of Nourish Science and an adjunct professor of nutrition at the Harvard T.H. Chan School of Public Health. Mr. Mand recently co-authored an article calling for more attention to health in the nation's largest food assistance program. Let's listen. Jerry Mand, thank you for joining us on Public Health on Call to provide a public health perspective on the Supplemental Nutrition Assistance Program, or SNAP. Can you start with some background on this program?
Well, thank you, Josh. It's a delight to be here with you today. So SNAP, what people in the past called food stamps, is really one of the nation's most important safety net programs. It's primary, indeed, safety net program today for low-income people. Its purpose is to make sure people have enough food to eat. It was created way back in the Great Depression, but really updated 50 years ago when there was hunger in America. And it really was designed to make sure that people had enough food to eat. It serves over 40 million Americans right now. Its budget this year is $154 billion. And indeed, it had its most severe test recently during the COVID pandemic, when people were right to sound the alarm that we may face a sharp increase in hunger or food insecurity. And indeed, because of the program, food insecurity actually went down during the pandemic, not up.
That's incredible. This is a program that a lot of people rely on.
A lot of people, 1 in 4 Americans are on one of USDA's feeding programs each year. And this is by far the largest and reaches the most people, 40 million Americans right now.
So I didn't totally appreciate the fact that all the fears about food insecurity were not realized during the pandemic. I know initially there was a pretty big spike in food insecurity. What happened after that, and what role did SNAP play?
You're right. There was an alarm sound appropriate at the beginning of the pandemic. Would people have enough food to eat, and what would happen to diet quality, diet and health during the pandemic? And these were important alarms. They were right to be sounded. There were things that we needed to make sure that people indeed had enough to eat and that the food made them well. The government, the SNAP program, as I mentioned, has been around for some time. So the infrastructure was in place. At the Department of Agriculture, you have the SNAP program and 15 other feeding programs that have been put in place to make sure that in times of crisis, in addition to all times, that people have a nutritious food to eat. Interestingly, just a few years ago in the Great Recession, there was a big test of the system. So in 3 years during the Great Recession, SNAP doubled in both participants and budget. But during that time, food insecurity increased substantially as well. This time, I think, maybe armed with that learning, as the participants in SNAP increased, the budget increased significantly. It had reached during the Great Recession a peak of $70 billion, and it dropped back down to $60 billion at the beginning of the pandemic. And as I just mentioned, it's over $150 billion now. So primarily what happened is Congress and the executive branch put a lot more money into SNAP, not just for those who newly became eligible, but substantially increased the benefits of all of the SNAP participants. And as a result of that, food insecurity for households and especially children actually declined during the pandemic.
So you have written an article about how important SNAP is as a health intervention. And I think that builds on the fact that so many Americans rely on it. There's so much food distributed through it, made available through it. When you look at SNAP from a health perspective, what do you see today?
So what you see is, that it does impact health by reducing first food insecurity, and second by lifting individuals out of poverty. So those two things, making sure that people have enough to eat and that it sort of lessens some of the general effects of poverty, has a big impact on health. First and foremost, people need enough to eat. And this program does an outstanding job in making sure that happens. And then you look at some of the basic measures like low birth weight of newborns, and you see that it's improved for those who are on SNAP. So it's measures such as that, the basic measures of health that you see at a high level get better on SNAP. But of course, it's a food program. So the next place to look is, how does it affect the diets of people on SNAP? And unfortunately, well, all Americans don't have great diets, and that's true for SNAP as well. But when you compare SNAP participants to people who are not on SNAP, people who are eligible and not on SNAP, the diet quality of SNAP participants is worse. So we're missing an enormous opportunity. We're giving people food, but we're not giving them food that would make them well. We're giving them enough calories, but not the types of foods that meet the dietary guidelines, for example.
It sounds like the main message is access to food through SNAP is very important for people's health. So they have enough to eat, and so that they have money to spend on other things that may be essential for their health, really, keeping them out of poverty. But when you look a little closer, you can ask the question, is the food itself healthy, really? Is it part of a healthy diet? Or are there ways that perhaps SNAP could contribute to health even further if it were healthier?
Exactly. And I'll give you an easy way to understand this. The government has a healthy eating index. It's a score that it develops at 0 for 100. That's based on the dietary guidelines. It measures the extent to which we're meeting those guidelines that are developed by experts to make sure that the diets do, meet the health needs of the American public. And the healthy eating index of all Americans isn't great. It's around the 58, which is a failing score. And on SNAP recipients, it's even lower. It's 55. The key thing, though, is USDA has another program, the School Meals Program, which is designed not just to give people enough to eat, but to give them better quality food, more nutritious food. And you and I together in the Obama administration, they improved those nutrition standards in the school meals. And before they did, this healthy eating index score for school meals was 58, as it is for the general public. In 3 years, just 3 years later, they measured again. It went up to 81, what I would call nutrition security had been met. And so I think what's important to see is that USDA has the power to substantially improve the diet quality and health of Americans. It does it with its other programs. I mentioned school meals. WIC would be another example. But here, by far, its largest program, almost 5 times the size of all of the other programs combined, it's not using its tools to improve diet quality.
And what's at stake for that? When you think about diet quality in SNAP, what could you get for health if the food quality were better?
Well, let me give you this metric as well. People talk about food insecurity, getting enough to eat. And in the United States, everyone should have enough to eat because we have enough food. But as I mentioned earlier on, food insecurity got a little better during the pandemic. But to give you the numbers today, 10% of Americans are food insecure. Less than 4% of households have very low, or what people think of as hungry, and less than 1% of kids. That should be 0 in America. We're doing better. It's gotten better, but it's still there. If you measure nutrition security using the healthy eating index, I said, 90 to 95% of Americans are nutritionally insecure. They have a healthy eating index score of less than 80. And over half have very low nutrition security, already sick, because their scores are less than 60. So by not taking advantage of this in the SNAP program, we get people enough to eat so we don't have the kind of just horrific situations that occur with hunger, but we allow people to maintain on a path where children in the United States are getting amputations because of type 2 diabetes.
Right. Well, that's horrible, but relatively rare. What common conditions do you see associated with diet that an initiative with SNAP to improve the quality of the food might address?
Well, I'll suggest four right off. There's overweight and obesity. There's diabetes. There's hypertension, and of course, in older age people, there's heart failure. Those four conditions, as you might know, accounted for 2/3 of severe COVID cases. And so it's not just in general that these are diseases that might reach us later in life, but in a situation like COVID, our ability to withstand that type of challenge was made that much worse because of just those four diet-related conditions that accounted for 2/3 of the hospitalizations and maybe 1/3 of the deaths. So, and that's COVID related to those illnesses. Of course, those illnesses themselves cause sickness, suffering, disability, and enormous increases in health costs.
And diet is quite linked to them.
Diet is linked to them. Of course, obesity is caused by diet. Diabetes is caused by primarily diet. Hypertension is caused primarily by diet. And many cancers, maybe 1/3 of cancer deaths are diet related.
So let's say someone accepted your premise that it's great that SNAP is reducing food insecurity, reducing poverty, and also there's now an opportunity perhaps to improve diet as well and address some of these very common conditions. How would you suggest the country go about doing that?
Well, I think there are a couple of things that we could do that could make a big difference, starting with the Congress or the executive branch making clear that diet quality or nutrition security, like food security, is a core objective of the SNAP program. And that's really not the case today. I had the privilege of working at USDA during the Obama administration for 8 years, where I oversaw these programs and had the opportunity to talk with staff. And as I noted, USDA has a bunch of programs. And so while looking and working on SNAP one day, it would be school meals or WIC on another day. And what became clear to me while I was there, that for the other programs like school meals and WIC, food security, fiscal integrity, and nutrition security or diet quality were sort of the three core objectives of the program. That's not the case with SNAP. It's really mostly food security, getting enough to eat, fiscal integrity, and nutrition, not so much. There's some programs, a nutrition education program, SNAP Education, a produce program to get people a little bit extra more produce. It's called by its acronym, GUSNIP. Those programs help a little, but it's really not what they do each day. They try to make sure people have enough to eat. And when I spoke to the staff and asked them why was that, why weren't they spending time focused on the diet quality of the participants on the program, they said, well, they weren't, Congress really hadn't told them what to do there. And so I think that ideally, maybe in this farm bill, Congress could finally fix that by making clear that diet quality, like food security, like fiscal integrity, are core objectives of the program. I would start there. That would be the most important thing.
And then what would that look like in practice? What would the SNAP leadership do to follow that kind of priority?
That's a great question. I mentioned before the Healthy Eating Index. They should use that to create a score so they can have on their dashboard a clear metric of how they're doing. And then they should begin to implement strategies to raise that number. And so they have some programs Congress has already given them. I mentioned SNAP Education. That SNAP Education, I hadn't heard about it before I went to USDA. Maybe many of your listeners hadn't. But this year it crossed $500 million as a program. That is a huge number across public health, not necessarily at USDA, where SNAP alone is $150 billion. So a $500 million is a small amount. But $500 million is 10 times the CDC nutrition budget, 20 times the FDA nutrition budget. And we need to start by using that program at a population level to improve diet quality. Today, it's almost exclusively used at an individual level, trying to work with dietitians who are wonderful, but they sit down one-on-one and they try to help you figure out how to eat a healthier diet by educating you, maybe giving you tips on shopping or cooking. That is wonderful to do. And for those few people who are privileged enough to be able to receive that service, it can be life altering. But at $500 million in a program with 40 million participants, they're only able to reach a few percent. That program needs to sort of embrace a public health. We began that work when I was there, and work at a population level, not one individual at a time, not even one school at a time, but really what are the population level interventions that they could do. And I'll give you an example of one that, I think is long overdue, if that would be helpful. Yeah. So, for example, the SNAP dollars that come from our taxpayers that go to the department and then go to people who are poor on SNAP don't stop there. Of course, they go to the retail stores that sell food. And they've seen just an extraordinary increase in the money they've received to get people food. So the large retailers like Walmart and Kroger, Amazon, they've sort of the recipients of the increase from 60 to 150 billion over the last few years. We ask almost nothing of them other than to not, maintain the fiscal integrity of the program. They do nothing to ensure the nutrition security or nutrition integrity of the program. We should ask them to do that. In the past, we've asked small retailers, the corner stores, the convenience stores, that they should at least have enough healthy food in their store for people to buy. That makes sense, but those stores make up only 20% of where food purchases are occurring. The large retailers make up 80% and we don't ask anything. So I'll give you an example of one thing we should ask, which is that they should not be able to promote unhealthy food in their stores, particularly to low-income people. Unfortunately, we know today that large packaged food companies, particularly the soft drink companies, pay retailers what they call slotting fees that each of us see when we go into the store, and the large displays when you first walk into the store at the ends of each aisle, they're called end caps of these products. We know from research that my colleagues have done at Harvard that those end caps and other in-store promotions increase the sale of the products being advertised 25 to 50%. But we also know that it works just as well for healthy options. USDA and SNAP should do more to tell retailers that, if you want the privilege of being in the SNAP program, you should not promote unhealthy foods, and you should promote healthy foods in your stores.
So I appreciate these points you're making, because what you're suggesting is that having healthier food in SNAP doesn't have to be just telling recipients what they can and cannot buy with the SNAP benefit, that there are ways through public health education programs, through changing the food environment that they're in, that people will naturally make healthier choices if given the chance. And in fact, the food environment may be slanted against them right now.
That's the perfect point, Josh. It's the food environment. I think the one thing we know about diet disease, there was just a big meeting on obesity. And the one thing that everyone agreed on, they couldn't agree on what necessarily causes obesity. There are a lot of theories about that. But the one thing that they were just completely agreed upon was unanimous, that it's not the individual choices and behavior of people. That plays a role. But what I think the public doesn't understand, what the food industry has convinced them, that this is your fault, it's your choices, when indeed it's the food environment. The food environment leaves most people very little choice, but to select the most affordable, convenient foods, which today, because our FDA and FSIS are not doing enough, those foods make us sick.
Well, Jerry Mand, thank you so much for joining us on Public Health on Call. You've given us a lot to chew on. I apologize for that. But this is a really interesting moment where the SNAP program has grown so much and has become a real opportunity, in a sense, for public health.
Well, thank you, Josh, and you're right. It's $150 billion. It's more than 70% of USDA's budget, and we need to leverage it not just to get people enough to eat, but to improve their health, something that they want help with, that the program could help them with.
Thanks for coming.
Thank you.
Public Health on Call is a podcast from the Johns Hopkins Bloomberg School of Public Health, produced by Joshua Sharfstein, Lindsay Smith-Rogers, and Stephanie Desmond. Audio production by J.B. Arbogast, Holly Cardinale, Philip Porter, Spencer Greer, and Matthew Martin, with support from Chip Hickey. Distribution by Nick Moran. Production support from Catherine Ricardo. Social media run by Grace Fernandez and Shian Briscoe. If you have questions or ideas for us, please send an email to publichealthquestion@jhu.edu. That's publichealthquestion@jhu.edu for future podcast episodes. Thank you for listening.